Have you ever imagined a world where a simple infection could be deadly? Where common treatments no longer work and medical procedures become dangerous? This scenario, which seems far-fetched, could become reality. Antibiotic resistance is on the rise, and the irresponsible use of these drugs could lead us to an unprecedented health crisis. But why is this happening? And, more importantly, what can we do to prevent it? Antibiotics, once one of the greatest advances in modern medicine, are losing their effectiveness as bacteria become stronger and more resistant. And the problem isn't just in hospitals, it starts at home, with the small decisions we make when using medicines. But the good news is that there's still time to act. In this video you'll learn what's at stake, how the appropriate use of antibiotics can save lives, and what each of us can do to ensure that these medicines continue to work for us and future generations. Antibiotic resistance is a growing public health problem in the United States and around the world. This phenomenon occurs when bacteria evolve to resist the effects of antibiotics, rendering treatments ineffective. There are several reasons why this problem has intensified in the US. 1. Overuse of antibiotics. Antibiotics are often prescribed unnecessarily, such as for viral infections, where they have no effect, or in inadequate doses, which exposes bacteria to the drugs without completely eliminating them, favoring the selection of resistant bacteria. 2. Inappropriate use of antibiotics. When patients do not complete the full course of antibiotics, surviving bacteria can develop resistance. In addition, the use of broad-spectrum antibiotics, rather than targeted antibiotics, can contribute to the rise of resistance. 3. Use of antibiotics in agriculture. In the US, the use of antibiotics in animals to promote growth and prevent disease, often at subtherapeutic doses, contributes to the emergence of resistant bacteria, which can be transmitted to humans through meat consumption or through the environment. 4. Lack of new antibiotics. The development of new antibiotics has slowed in recent decades, while bacteria continue to develop resistance to existing drugs. Antibiotic research and development is expensive and has not been a priority for many pharmaceutical companies. 5. Global spread. International mobility and travel facilitate the spread of resistant bacteria. A resistant infection acquired in one country can quickly spread globally, including in the United States. Consequences of antibiotic resistance. Difficult to treat infections. Common illnesses such as pneumonia, urinary tract infections, and sepsis become more difficult to treat and may require alternative treatments that are more expensive, take longer, or have serious side effects. Risky surgeries and medical treatments. Many medical procedures, such as surgeries, chemotherapy, and organ transplants, rely on antibiotics to prevent infections. With increasing resistance, these treatments become riskier. Increased deaths. An estimated 1,000 people die each year in the United States from infections caused by resistant bacteria. Measures to combat resistance. More judicious use of antibiotics. Healthcare professionals are being encouraged to prescribe antibiotics only when necessary and at the appropriate dose and duration. Development of new drugs. Efforts are being made to encourage research and development of new antibiotics and alternatives, such as viral therapies that attack bacteria, phage therapy. Public education. Campaigns to raise awareness about the correct use of antibiotics and the risks of resistance are essential. Antibiotic resistance is a complex problem that requires coordinated efforts between healthcare professionals, governments, industries, and the public to mitigate its effects. Responsible use of medicines, especially antibiotics, is crucial to preventing the antimicrobial resistance crisis from worsening. Antibiotic resistance occurs when bacteria evolve to survive treatments that were previously effective, and this has serious implications for public health. The importance of responsible use of medicines includes several aspects. 1. Preserving the effectiveness of antibiotics. Every time an antibiotic is used inappropriately, the chance that some bacteria will survive and develop resistance increases. If antibiotics continue to be used irresponsibly, we may run out of effective options to treat common infections, which would make routine treatments much riskier. 2. preventing untreatable infections as resistance increases. Infections that were once easy to treat with simple antibiotics may become untreatable or require more aggressive, lengthy, and expensive treatments. Infections such as pneumonia, skin infections, urinary tract infections, and even tuberculosis may become much more difficult to control. 3. Protecting advanced medical procedures. Many medical procedures, such as surgery, chemotherapy, and organ transplants, rely on antibiotics to prevent infections. If antibiotics lose their effectiveness, these interventions can become extremely risky, compromising patient safety. 4. Reducing the spread of resistant bacteria. The irresponsible use of antibiotics in one patient does not only affect that person, but can contribute to the spread of resistant bacteria throughout the community and even internationally. These bacteria can spread to other individuals, especially in settings such as hospitals and clinics, where there are many vulnerable patients. 5. Contributing to the sustainability of public health. Antibiotic resistance is becoming one of the greatest threats to global public health. Responsible use of medicines is a way to prevent the proliferation of resistant bacteria and to ensure that society has effective medicines in the future. Without such care, we could enter a post-antibiotic era, where simple infections can become fatal. Responsible use practices. Use only when necessary. Antibiotics should only be used to treat bacterial infections diagnosed by a healthcare professional and never for viral infections, such as colds and flu. Follow the prescription correctly. Patients should take the antibiotic exactly as prescribed, in the correct dose and for the recommended duration, even if symptoms disappear before the end of the treatment. Avoid self-medication. Using antibiotics without medical advice or using leftovers from previous treatments increases the risk of resistance. Education and awareness. Healthcare professionals, patients, and the general public should be aware of the risks associated with the inappropriate use of antibiotics. In short, the responsible use of medicines is an essential measure to protect public health and ensure that future generations still have effective treatment options against bacterial infections. So now you know, the responsible use of antibiotics is not just about your health today, but about ensuring that these medicines continue to work for everyone in the future. Small actions, such as following prescriptions correctly and avoiding self-medication, make a huge difference. You are not alone in this fight. Each of us can be part of the solution to prevent a global crisis of antibiotic resistance. Talk to your doctor, share this message with friends and family, and be mindful when using medications. Together, we can change the course of this story. If we act now, we can ensure that future generations will have the same safety we have today when facing an infection. Thank you for watching and for joining this cause. If you enjoyed this content, don't forget to like, share and subscribe to the channel. See you next time.